My name is Zarrar Duraiz, and I am the owner at Contractor Dentistry in Denver. We are a general dentistry practice, and we provide procedures from basic restorative all the way to implant dentistry, Invisalign, and cosmetics. I was thinking a lot, and I wanted to figure out a solution for the construction issue, both in terms of the cost that the construction would be, and with the pandemic, everything was just backed up. And I wanted to avoid as many obstacles as I possibly could. And I started thinking about it. I was talking to my wife, and I was like, there has to be an alternative way. So just like any general dentist, I started thinking about how I could personally fix it. And honestly, I had worked with air compressors in the past as a dental student. I had the setup in my house where I used to practice, and I just had to figure out a solution for the water problem. I went through your guys' website, and as soon as I saw that you were making units for the military, at that point I was like, okay, I don't need to engineer this myself. There's people out there. Basically, that is how I got to ASI. And once I found out that you guys had been in the business and you've been designing this for quite some time, it kind of solved a lot of problems. One of the biggest things that the concept of ASI having these units mobile and being able to place them wherever I want is, in my experience working 4 or 5 years in corporate dentistry in different parts of the country, different companies, big, small, all of that. What I learned about dentistry was that what mattered was what was underneath the floor. So even though we would be getting brand new chairs, amazing handpieces, probably because of leaks and problems which were underneath the floor, because these offices were quite old, there was always problems. There was always problems with the air pressure. There was always, the technicians were in there. They didn't know what to do, and obviously ripping the floor open and doing the construction from the get-go is definitely not something profitable for certain institutions. So for me personally, I wanted something that was decentralized. I was very big on that because that compartmentalization would allow me to have repairs go on in one part of my office while I'm still working with full efficiency in the other without having to shut the whole thing down. So it was key in my quest for this freedom that I wanted with my dental office, and ASI was the answer. As a very nervous, anxious dental patient, I learned from my personal experience when I sat in a dental chair one day for a cleaning. I had this thing staring at me, was a dental light. And I realized that in that stressful moment, that dental light just dangling in front of me, it was like a T-Rex, and it was just adding to my anxiety by a lot. And also as a dental provider, it's my goal, because most of my patients have dental anxiety, it is my goal, it is my job to help my patients with that anxiety. And I realized that having all these, you have the TV screens hanging over here, you have the light over here, and you have these bunch of pipes and these weird looking things that the patient doesn't understand, and they can be very frightening. And so I realized is that if I had all of these things removed from my scope of vision as a patient, I would feel a lot better, a lot comfortable. And if everything was kind of like behind me, maybe it would be a little bit better. And that's again something that we have been able to achieve very successfully with ASI, because all of my system, everything that I have to use is behind the patient, yet it's still mobile. So if I decided to change the orientation of this chair and face it more southwest, I could do it. And I could just move this unit over there. Amazing. It gives me a lot of options. We are facing west here in Denver. We've got the beautiful view of the Rockies. I have my TV screen over there, and that's all the patient sees. And there's nothing around them. And I have gotten this response from my patients that whenever they sit in this chair, they're like, "Doctor, this is the most high-tech experience we've ever had." But if you really think about it, it is It's just, we've basically reorganized everything. It's not some Alienware technology that we're using, but what we have given them is that room where they don't have to stare and they don't have to maneuver between the dental light and me pulling my instruments out, and that just gives them a very comfortable overall experience. The biggest thing that ASI made it easier for us was in terms of finding the right location. Since I did not have to do any plumbing, I did not have to get a contractor at all for this space. I know that can be a daunting task. Because of ASI, everything in my office is still mobile. I can literally pack my office in the back of a truck over a weekend and move locations, which made it really easy to negotiate my lease agreement. The unit is running right now. There is no sound. Because of the savings we were able to do, because of a lack of general construction, we were able to get all electric handpieces. So that just, there's absolutely no sound. I have used air-driven handpieces, and those things are loud. They're very, very loud. We do not have that problem. And the unit itself has absolutely, in terms of sound, there's no issues. In terms of running my handpieces and all of that, there's absolutely, I've never had the ability or the opportunity to work with electric handpieces before. Because of the savings that we were able to acquire these, and I'm working with electric handpieces, and it's amazing to be able to perform procedures with it. In my entire experience as a first-time business owner who's never been in business before, this has definitely been the best of the experiences that I have had. Their entire assembly is in the States. They are delivered on time. Everything works perfectly. I'm able to ask questions, make modifications. We personally do envision on adding ops, and we're going to be getting more ASI carts. We do envision of branching out in the future, and there's absolutely no question that we will be using the same carts. So do I recommend ASI as a viable option? Absolutely.